This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome everyone. I'm very excited about today's discussion as we are going to be discussing the new WHO physical activity guidelines. And we have a guest who has been in the group creating the guidelines. He is Professor of Physical Activity, Lifestyle and Population Health at the University of Sydney. He is the Charles Perkins Centre team leader on physical activity, exercise and energy expenditure. Ladies and gentlemen, I'm honored to welcome our guest, Professor Emmanuel Stamatakis. Welcome, Manos.
Hello, Olli. Thanks very much for inviting me back. It feels like a really long time since we had the first podcast. I've been trying to remember when it was. It really feels like 6 years, but it was perhaps 6 months ago.
I think it was a little bit over 1 year. It was
a year ago? Okay. It feels like a different era, and perhaps it is a different world. Now it's a different world compared to then.
Yeah, I think last time it was your morning, it was my midnight, and now it's my early morning. So that's the difference here. So I wanted to discuss about the new recommendations. So congratulations for getting the new recommendations out. It was probably quite a bit of work behind the recommendation. How do you feel now that they are out?
It's a mixture of feelings. All of them are very positive. I think it is there is an element, very big element of joy and pride. I'm very, very proud of the final product, the final guidelines. I'm sure each and every member of the guidelines development group, WHO, everyone is really, really proud. There is an element of relief as well, because I have to admit that the guidelines put quite a bit of strain on my work schedule. I was involved in many capacities. So I was co-chairing the guidelines development group. I was leading the adult physical activity recommendations, the development of the adult physical activity recommendations. And then on top of that, I was one of the two editors of the British Journal of Sports Medicine special issue, where the main guidelines paper, as well as another 9 papers, were published concurrently when the guidelines were launched. So, there were times when perhaps I would dedicate 3 days of my week to guidelines, and there were months where much of my team would work on the guidelines around September, October, November 2019, when we were reviewing and screening the evidence. So there is definitely an element of relief, but I'm very, very proud. I'm very, very proud of the final product. I'm very proud of the BJSM special issue. And I'm proud not only for personal reasons, but I feel and I strongly believe that they will have a positive impact, a large positive impact and they will lead to tangible change. They will strengthen the case for physical activity, advocacy, and hopefully in the long term, they will lead to more people being physically active and getting closer to the GAPA, Global Action Plan on Physical Activity 2018-30 targets.
Yeah, I believe the same. I think they are very good guidelines. And how was it working in the team creating these recommendations? How was the process? Was it easy to find consensus, and was there something that took more time to find consensus within the group?
Yeah, so the process, first of all, we followed established WHO standards, the WHO Guidelines Development Handbook, WHO standards for evaluating and grading the evidence. And in total, the Guidelines Development Group comprised approximately upper 30s to 40 people. So we had the first meeting in Geneva in July 2019 was around the discussions were mostly consumed on trying to identify the population exposure or intervention comparator and outcome, the PICO sequence that is many listeners I believe will be familiar with. And we also decided about what outcomes would be considered as critical, which outcomes will be considered as important, and which outcomes will not be considered. So it was preparing the July 2019 meeting in Geneva, prepared the ground for all the work that followed from that point on. As you pointed out, the guidelines were based on consensus. All guidelines were based on consensus. And the discussion of the evidence we had reviewed between August 2019 and February 2020 took place also in Geneva in early February. And I'm very happy, very glad that there was no need to vote on any of the guidelines. So consensus was reached on each and every recommendation. Of course, some recommendations, the discussion took longer than others. There were some quite straightforward, some were slightly more complicated for various reasons. Another very important part of the development process that I should let you and listeners know is that we saw no much point in reviewing the evidence that was reviewed by the Physical Activity Guidelines for Americans Committee. As you perhaps know, this is an extremely rigorous, the Americans follow an extremely rigorous process over a couple of years involving some 100 plus scientists and technical personnel. And we made use of these reviews. And so effectively, the evidence we reviewed firsthand was 2016 to 2019. And we concentrated on reviews. So the committee, the Guidelines Development Group, reviewed only reviews, not original studies. Original studies formed part of the discussions in February 2020. But strictly speaking, the vast majority of the evidence was published reviews of the last 3 years.
So a lot of reviewing papers and using the ACSM and Canadian guidelines for the adults and children. So what are the
sorry to interrupt you. It's not the ACSM. It's Physical Activity Guidelines for Americans.
Sorry.
CDC.
Yeah.
Or PAGAC, as we call it.
Yeah.
It's a mouthful.
Yeah. And what are the main new things in the recommendations? Probably there's many things, but what do you feel that it's the main new things in these recommendations?
Yeah, there are two different ways to describe and list the new elements. So one would be to list what is new against the 2010 WHO recommendations. And the list is very, very long. And then if you want me to, I could list what is new in the sense that it has not appeared in other physical activity recommendations. Because these are global physical activity guidelines, perhaps the former has more value. So what has changed in relation to the 2010 WHO recommendations? So first of all, I will start from new populations that were specifically covered in 2020. So we have specific guidelines for women, pregnant women or postpartum women. We have new recommendations for people who live with chronic diseases or disability. Then we have new recommendations in relation to 2010. we have quite a few changes to existing recommendation and quite a few new recommendations. So first of all, the aerobic, the headline recommendation, is not expressed as a cutoff value, as a threshold. It's expressed as a range. It's 150 to 300 minutes of moderate, or 75 to 150 minutes of vigorous physical activity per week, or equivalent combinations.
The 2020 change that had perhaps the most profound effect on the key messages that WHO chose to put forward upon launching these new guidelines is the removal of the 10-minute bout. In the 2010 WHO recommendations, physical activity was considered to be health enhancing and counted towards the recommended amounts only if it lasted for at least 10 continuous minutes. In 2020, this lower threshold does not exist anymore. And this change literally shaped the core message that WHO disseminated upon launching these guidelines. All physical activity counts, no matter how brief it is. In 2020, there are also two new sedentary behavior specific recommendations. The first one is somewhat generic. It's about adults limiting the time they spend being sedentary. And that comes with an interesting extension because it specifies that sedentary time could be replaced with physical activity of any intensity. And specifically, light intensity physical activity. It clarifies that light intensity physical activity is more than welcome. So light intensity, there is no specific recommendation about light intensity physical activity, but the generic sedentary behavior recommendation is clearly implicit of the value of light intensity activity, for which we do not have sufficient evidence. The second sedentary behavior specific recommendation is yet again somewhat a combined physical activity and sedentary behavior recommendation. And it is about reducing the deleterious effects of very high levels of sedentary time by aiming to exceed the recommended amounts of physical activity. For example, more than 300 minutes of moderate intensity activity or more than 150 minutes of vigorous intensity activity per week. So this physical activity and sedentary behavior changes are applicable to adults, older adults, as well as to adults living with chronic conditions and disabilities. I would like to highlight one further change in relation to the 2010 recommendations that is specific to older adults. This is the recommendation is that all older adults should aim to take part on at least 3 days per week, take part in multi-component exercise. And by multi-component, we mean physical activity that addresses concurrently aerobic capacity, muscle strengthening, and functional balance. In the 2010 recommendations, this piece of advice, this was specific to older adults living with chronic conditions. There were also some important changes in the recommendations for young people aged 5 to 17 years, children and adolescents. First, we had the change in how the daily recommended amount is expressed. In 2010, the WHO recommendations for young people were about doing 60 minutes of moderate to vigorous physical activity on each and every day of the week. So the 60-minute threshold had to be met on each and every day for someone to meet the recommendations. Now in 2020, we have 60 minutes, the same target remained, but it's 60 minutes of MVPA on average. In other words, a teenager who does 100 minutes of MVPA in one day and 30 minutes on another, they will have met the targets, the 2020 targets. However, they would not had met the 2010 targets because the target was about meeting the 60. The recommendation then was meeting that 60 minutes per day target on each day of the week. And of course, we also have sedentary behavior recommendations now for young people. Like in adults, there is no specific threshold attached to the sedentary behavior recommendations for children and adolescents. There's a generic recommendation that young people should limit the amount of time they spend sedentary, and there is some particular emphasis on recreational screen time. There's a particular reference on limiting screen time. Now, taken together, all these new elements that the 2020 WHO guidelines are bringing in will have some quite major consequences on how we monitor progress with physical activity at the population level. Will have major consequences on what we call physical activity surveillance, national and global physical activity surveillance. Most questionnaires that are used for this purpose, like the International Physical Activity Questionnaire or IPAC, the Global Physical Activity Questionnaire or GPAC, they inquire about physical activity that lasts for at least 10 continuous minutes, simply because that's what the previous recommendations were inquiring about. Now, all these instruments will have to be redesigned, perhaps. It's not as simple as removing the 10-minute bout question from the questionnaire. Once you change the questionnaire, ideally, you should test it in your target population. Make sure that people understand and it does not change, it won't change other aspects of the people's responses. And that could be quite challenging. That will, I guarantee that will give headaches to people who work in surveillance. Having mentioned surveillance, I would like to take the opportunity to highlight a number of other important functions that these physical activity guidelines have. Some functions that perhaps are not as obvious. The physical activity and sedentary behavior recommendations are not merely advice. They are advice. They're an important communication tool for us researchers to communicating physical activity messages to the members of the public, healthcare professionals. They're an important tool for healthcare professionals in turn to communicate physical activity messages to their patients, and several other layers of communication. So there's no doubt about that. They are an important communication tool at the advice level, at the physical activity prescription level. They form the targets for physical activity campaigns. Typically, these recommendations will become the contents of future physical activity campaigns, future clinical prescription programs run in hospitals. So the new guidelines have a big role in implementation as well. So surveillance, messaging and communication, interventions and implementation. And the fourth very important function is perhaps the most obvious one. So what we did during the development of the guidelines process is we were reviewing scientific evidence using standard WHO very robust protocol. So the end product, these guidelines are also represent scientific consensus, some quite robust scientific consensus, both about what we know about physical activity and the health effects of physical activity sedentary behavior, and what we do not know. And that's yet another very important function. So these guidelines will tell us what is it that we need to understand better what areas of research we need to invest more so that we have better, more complete, more accurate and guidelines that are easier to communicate in 2030, when we will hopefully have the next update of the WHO recommendations.
Yes, so very, very good points, and good that you opened the critical function of these recommendations. I think many people can miss out some of those, and as a main difference, you said that the minimum bow duration was changed, that anything counts. Earlier it was 10-minute minimum, so basically the threshold of minimum dose is coming down.
Hi, it's Dr. Arto Pesola, co-founder of Fibion. We are happy to soon launch a product that will save a tons of your time. The new physical activity guidelines will be more and more based on device-measured data, and this means that we need validated and easy-to-use tools to measure sedentary behavior and physical activity at a scale. For a researcher, this means a lot of work and effort on logistics and on data analysis. We have been working hard at Fibion to make this process easier, such that automating the logistics and data upload processes, and we are happy to soon announce a new product that will do all this for you. So stay tuned, and meanwhile make sure you read the excellent papers around the updated physical activity guidelines.
Thanks for joining us this week on Physical Activity Researcher Podcast. If you like the show, make sure you never miss an episode by subscribing or following the show on Twitter. This podcast is made possible by listeners like you. Thank you for your support. If you found value in the show, we would really appreciate a rating on Apple Podcast or whichever app you're using. Or if you would, in a real old school way, simply tell a friend about the show. It would be a great help for us. We have a fantastic lineup of guests for forthcoming episodes, so be sure to tune in. Thank you all for your support and have a great day.